dia ngania ba bier el lekola edol me aset te ba bier ngat el la cuisi bir ngi la sil sem le swak forward ngi le kor miu en dik pili ang akling wasen akim la mga do la malo bakim la reply moral lagi del concern ngi lagi del melus le kor gao tiaspek ui le kor mi akum da sun telgi bil ngod atol lol goy en ding atu mga nya temi e dia remind den spek ui te de ba bier gar dil prevents sirngi ya Kire del eriter del murangagi del ngalgar belau el gagi del grievances ringi we're all in it. Ndi asem lo nas la sensam emergency me kamer belau e tirgagi del momas tir la amadar der mar demrir mar ngalgire de asem mestrin you're not alone in this thing. We're all in it. Ngari tirgel mom gorior mo de alestrira ar demrir der malo de vir tire mergot mosmere medakl. We're all in this. Mangira del moment ngel was diakoram sakar meri term dik was let's face the reality. Tial rakta dia hal pick and choose rasen tabo kimrelin mosmer. Ngel kuklo ungi no smer mamita ungi mosmer. We all have to understand the lesson. Dia hospital accommodate malo make everybody happy. Yung dingaria gidel guidelines ngara city sil ngal member ko say what is the fairest way to treat everyone the same and equally. O mediaso da second legal former minister ma un ex-president sa emelo ya harbaid me so ispagegi toya ya exist I hope. Okay, masuma ya temi we sola embo kiwi tial maldimre de mergo at im gamet tri malo ben dia pas que me rapid tial ba bien di I think you do have a copy of it. Do you mean? Okay. Thank you, gentlemen. Quote, thank you, gentlemen and ladies. Thank you for hosting this discussion. Let me preface by saying that I certainly understand the precautions Palau is taking to ensure the safety of everyone. I have colleagues who have lost loved ones to COVID and living through the pandemic in California with my kids doing distance learning and working from home over years is challenging. Due to family emergency, I and my kids were hoping to visit Palau. According to my sister in Guam, in order to travel to Palau, I need to complete the quarantine certificate application. I also reviewed the Palau travel website. Okay, I'm not going to read the website, it's long. I sent my application on Thursday, April the 8th, 2021, and received a response there is maximum capacity of 50 passengers, departing on or around May 9, 2021. Therefore, I was not able to get on the flight. I responded that I was disappointed. This information was not disclosed, nor was there indication this would be an issue on the website. I also stated that your office needs to be transparent in disseminating such information. Your colleagues replied with the following response. Number one, I should travel through Taiwan. Number two, there are folks who have been on the waiting list to catch the flight. Number three, that I should have applied earlier. Number four, your office has been sharing this information with Palau's press and radio stations. And here's her response. My response to each point. Number one, easier said than done as the financial cost is twice as much. Two, I never negated the issue of the folks who have been on the waiting list and certainly understand and supportive. Number three, your office neglected to read my stated reason for traveling on the application emergency visit, and this is an emergency and therefore couldn't be planned. And four and last, if this information are readily available with the press, therefore the information should be updated on a regular basis on the website. There is a misnomer. If the information is available to the press, therefore it is available to everyone outside of Palau. Your travelers are outside of Palau. So one should make every effort to make this easily accessible, transparent, and coincides to travelers. One issue that I want to point out, I've heard from you and the President Surangal Whips stated we are following CDC. This is not the case. The lack of information and clarify does not consider the fluidity of the CDC's most recent press release on travel for fully vaccinated people. What is the process for fully vaccinated people who show and prove with their CDC vaccinated record, and does the traveler need to quarantine for 14 days subject to taking the PCR test 72 hours prior to the departure with a negative test result? Let us talk about the financial respect. I sat down and did the numbers, and traveling through Taiwan will cost twice as much as traveling through Guam. Also, if minimizing the quarantine time due to being fully vaccinated, this will abate the quarantine cost. I certainly understand if the traveler hasn't been vaccinated, therefore they should be quarantined for 14 days. Your office needs to be better than this. Thank you for your consideration to the foregoing. Sign, blah, 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 blah. Okay. What do you think about that? I know it was long letter, but they asked me to read it to you on the air, so which I can.
Yang way se agi mail ayamar el mora ang kagidel still a letter el wasing amral bebira time and agi transparent agi mo malas make sure el moving forward el wasel quarantine certificate site ang aringi specifics el ngaringi es ki kada develop pa gidel el guidelines agi mo malas mal ensure el wasay accessible through say gidel el website tra quarantine certificate ese di palaw.gov.org sa bari adel palaw.gov.pw palaw.gov.pw mal di ro say gidel search engine ang ngaringi say gidel quarantine certificate di agi direk al ayamaring COVID-19 na ABS el rak tempat to katilang tingil el dakado tingay el da doral mong pol bato kado tingay and then katuk adjust tergi del moraigel el do tingay say el time so sira waleleng wimla ka vaccination mang aigel duru lelwal kura pre-quarantine rakwa me test me quarantine tang test aige kupmla mo amral mo diak esa vaccination rate tra rigida ma kwa may gablul adro gira amral morbab and the CDC kamadangileng mlartiang tirgil adra HHS ra last month tirgil siragi maadadu et amral wase al sugumas kogi a mixed ar adal ngara al sel belgula say the vaccinated, maridakal vaccinated, al sugum ta mix en giri rogu il mura quarantine. Hindi al sabed al differentiate tra adal vaccinated, al ngara al selas kogi lobangela adal dakal vaccinated. Leng ngaringi say dal tel kadam las modil wasay tial vaccina a primary function niya mo a protector from getting severely ill. Yan malubi kamas. Yakal protector raul el diam pomut tial rakt mangari segi del te al sab emel di mosmera even ma plam vaccinated mal sugum ko bangela adal dial vaccinated en cell risk raul ngarak tam mangal morba guidance ra CDC tirgai del technical expert ra CDC gi morior kim dalorior seral ngartel las mandet de la sei al sugum maskogi a mixed el ngaringa de al vaccinated ma vaccinated eti rogu ya mura quarantine mang sel skogil mler tel skogil dirgam lel ngarakwam amle waisei ngaringa adal mlara al sel me vaccinated ngaringa dim la al vaccinated menti rogu il mlara quarantine el asegi de la directora public health amle mention ngira leadership conference was moving forward ya mlamot tulay tal the chance tial el May 9 le already tirgay del el 15 mlabu ngiya a mixed travelers mandakal sabi el implement ngir say del wasay el gukti mumsadar vaccinated.
I see.
Mo regular tayo del skogil maral may ya bes el wal bodoru ngil guidance el maral mo nga say al sugum ka vaccinated may ngara skogil lo bantrira rogul adar al sela skogil giril vaccinated. Ya sel omer belaw endia ka bora quarantine ending ngaring say del restriction of movement malubang ROM album through ngil 7 days. Tiang able the implementer ngiyang ngel milu sa tilangal abiakal regularly or reng sarakawe reng sargide tuli if you recall it tirgel other HHSL mayor seral may iko the silo dil wasay tirgem laras kogil di tiltang 15 emle tirogul vaccinated at least 2 weeks prior to departure emle test negative ra 72 hours masera lemay at tirgay del mlay kada test tir airport et tamlora restriction of movement test saygi daliga and then it wobda mang saygi dia ya kada ko di lekal silodi lo saygi dia moving forward saygi dia bodo mesringil giri travelers el vaccinated ding medire qaldik waisel wasay tilagi de los siul adara city stiral may adilul wasay ndir ngal kadam tengel wasay under 18
I see
alubet under 16 depending asing Pfizer Moderna adirga kalbol sabil vaccinated malsugum tirga nga kal vaccinated travel lovan three parents vaccinated and giril mo quarantine I say. So say I hope say clear understood. Malsugum tal kuk kabesel guideline el bodol tob ringiya wasay ngiri other rogul ngaras kogil vaccinated. Eng la wasay amo ti kal sabrira ngal kal vaccinated el mas tal skogi.
I see.
So I hope say telgibel korak amo clear.
Ya aquí kami gidel ngar belaw tirgaba kira outside magatutangar outside dialo tangli aringal pangar alsel we're trying to survive kira ngar outside lang magatu kira pleasure kira was how can we survive through this no please kami outside magkamamit ruwa detail marwa kafar marwa etol mamal maring loreo short staff short supplies from time to time so please bear with us as we go through this as a nation
Why lang direkal hindi ko nila sige do silo din gele medical referred patient tel narablul abang kem lamay kung ko ramil sa dari lalas ta ko wasti ko do ko ada do gid mar adara ablul abel gire la travel bubble for medical referral purposes ang ngaringiya wan adara ablul abel mle el ngara medical referral nga vaccinated 2 weeks prior ngilua test 72 hours mapilot raskogi ngilua test 72 hours before alamay mengegi dalmle yakadamle test ngira airport mle negative kadamle transport ngi mangarawan na gaygi del hotel certified del pandemic hotels engarsegi del restriction of movement mo testra day 7 testra day 7 ending ka ko ngara restriction of movement ding kamil ngara ko rule mang sabel during that period ngo mask mora tok tangaringil mora mo access sa medical care kadamdengel wasi ablul aba COVID free
I see
oy mangwal dia ka COVID say ending gina dal kadokora mal plol di masada new normal tulige kadowal dokora practice rigi del wasi adoral mo ay gay gidi amo routine el doru rapid time mang even though in COVID free blul up mabelaw COVID free ding protocol ma process el bled implement malol tirak leng sawada di lo sisiwe dil tabsul mora arukul af
I see
tulig awara dolmol medita ti soal muktal morsel last point
Okay.
last year ang laringya igay del buk ongit mer kamamra IOC magim level oil el join ako ra meeting ra alad ma amanyar bebira agencies will request a presentation ya tara man le question ra last year was silbonia vaccine and the also will require other vaccinate temer belaw mamle henjil morse was a priority ra ministry ra health ra adal ngara el sel belaw
I see.
mang kada ay amare oling takoloreng ra adara bulul gire la travel especially ra adal na vaccinate was ngrama CDC na to dia akaidan sila si kama manamos sa mamal freely travel el dia quarantine lagim lamrus din dia dobes sila si adal ngar belaw baby tira dinga kolorus
I see.
Igi da priority ko mamagi make so that make sure adal ngar belaw ker belaw am lamrus igi da musa be edlo mesra
Outside.
Listen, kumilungi witel el-email at tara agera wasi ngaranga process ra adal ngar outside el sorry mail al show a proof for a vaccination. Say dirga kal dia ka pelura adal mla gut please el process.
I see.
Egi da matingin la kadana marus sa di imol dungu akar dal di ngan yang kledal di handwritten ma. A type ra vaccine mandirga kal makatmok sel system el sa edal verify.
I see.
Ang awul magdidirect kalwase hal dongin masel gid al ngarbela am la reach ra at target trigid magda klorungu dalwase al ngoy awan al adal al le falsify a document trigi at least tigid al ngarbela wasel ba
Wise.
magdol ngi tra kloring ra adra bulu wase laway gil liru litter tiang apa esel teleta la gadadir kam suberngi batoka bulu ram rigel against tigid al dulwase immunity passport
Wise.
Mengira dal mokorgi klaseng makarang aku tolay kay gidal recommendation guk mo atter gidal ada belaw. Di number 1 a priority ra ministry ra health make sure adal ngar belaw asal ba akla. Mang gwadim na social share sa gidal maral ne one point ra adra tourist ra gim adra tourism industry ra gim present mo tira last year se bobe ring ram da kawiti the require adal vaccinate taw berbelaw. Maral nga bay gidal sobok lidal what taw era da entertainer other mesois.
You said it all.
I see.
Okay. Biar malak, ambil asuli.
Kada na lang lakit tulig hindi kumdaseng manle word ringi. I'm sure ang gel na email dia kadiling itang. Agi ba imre nga sule lal mla sabe el voice of concern ringi through media ngo otilo semral to kara adal nga nya concern certificate la dia clear ra igal website may gal talk show dorun magidirect kalmera nga sule el willing el approach sa media approach ra we kuk share concerns ringi sure she's not alwagan dilung she's not alone nagidro gul ngatel lomrael ra pandemic mong open direct through her email en la insera question of tokol at
en elang ge oreng selektilor ngila se bortagi del no makmis sa address no se bortagi del WFM Amidias Broadcasting webpage and mo reng singira kapsingira 7 o'clock palau time mo reng stigi
saya kama wagel dilu retail agi mo already ge uro material adra quarantine certificate the partial overall response and the agi mo malas man make sure moving forward ay get rogul gora anticipated el gel dulu sing frequently asked questions magora way sige dala sa mamal malgorti makadalolyara website tamong sira adal mo fully aware informed ra ay gel latest the protocols del doctor
no I say
adi gigi tulig alla ka ngod el questions
mal exactly 1 hour
sugum diga ka diga ngod el questions dito maklat kalwa a scheduling ra umrus sa malmol mara next week lo spera mother na igida kuk mangira a further guidance ra Johnson and Johnson magidil mutulolingit ra adra bululo asem kola gigidil 4 numbers at sugum dirga kan already submit ang claim ra kumbali tira di mo ko kami a schedule ma
okay kami hold the kafare alim ngil go sngay
sa concern ng accident tumundas
kamlut
la orus matastri la orus yak la orus sa pangamal mention kasi kamoli marom yak mistri After oras sa lima. Pakalumon tapos.
Tiga tingin la orus sa limarom?
Maro.
Okay.
Sa isa, cancer ng alpinito.
Okay. Ereng tiga kita adra iyo silo reng sadang Okay.
Nakambal masulang gel caller raise a concern ringi.
Okay.
Emerald wise tulig sel bodorus at tirigel toktangal ngasel observation malulingit tilwa sel dungwa urus at least 24 hours dagdoli marom. Se tulig mararingi well there's two things. One at sugum maadam mo niya side effects ang gira del momdingilo sityang side effects tra urus ngilo atang romaloli meringi.
I see.
Gira del mo differentiate say. Number two at sugum kangwa urus emili marom apatangya mawal ngara overdrive lo ngwal gigaring at lela apatangya mal react to mortel urus.
Ay.
Gira ko called the electrical effects at rom.
I see.
There's two things going on there. Again, nakadadil mo tulong ng traffic lahat, selve mo lang urus, both first and second dose. Please sabay mo rin marakloran, 24 hours, the refrain na umilim alcohol, umilim rom. So lang ang gel caller.
Okay. Di ako kom laro liaw ready rusura at hindi life ringi ako ngar alert from there on. Asung tilot tirak lang he's gonna face the problem later on. Hindi that's his problem.
I see.
Okay, hindi ako tagas masubugong.
Okay, sulang tulig direct sulang mara atra Eco Paradise lolo mong gid.
Okay, may karo. Tracy, I hope you watched me as I read your letter. If not, we're going to put this on YouTube, so you can go up to YouTube and go to Diaz page, which is Diaz Broadcasting Company. And make it a habit of going to our page and listen because there's a lot of information you can get from that. Yeah. So take care of yourself and. We're going to try to keep everything in order and be on the lookout for you when you come to Palau Sunday soon. Okay? Bye-bye now. That's my team. Pero isa sura sa kita menulbong ang program gift book next Wednesday good hotel am lidio de na Alfonso Diaz sa. Thank you so much.